Hello, welcome to my YouTube channel. I'm Cynthia, the microbiologist. So today I have a very special topic for you guys. You are welcome, and we're going to be having a special health sensitization on hepatitis. So I know you must have heard about hepatitis, or if you're just hearing it for the first time, you are welcome. So, we are going to be talking about inflammation of the liver. First, I'd like you to know that hepatitis is an inflammation of the liver. So, we have so many types of hepatitis. We have the hepatitis A, we have the hepatitis B, we have the hepatitis C, D, and E. So now I'll be taking it one step at a time. And sorry, this session will have another episode because it's very much it's voluminous to go on one episode. So the hepatitis A is simply an inflammation of the liver that causes mild to severe illness. That's what it is. So this type of hepatitis is transferred through direct contact with an infectious person, is or mostly transferred through ingestion of contaminated food and water. So then how is this mode of transmission? How does it happen? If an infected person physics gets in contact with the water or the food an uninfected person consumes, it gets the person, like the person contacts hepatitis A. This is how the mode of transmission works. And again, it happens through direct contact and through oral or anal sex. These are the mode of transmission of hepatitis A. Hepatitis A is not a kind of pandemic, it's not always having a high mortality rate. Like in the year 2019, it has a 0.5 mortality rate. So you see that the mortality rate is not high. So people who get sick of hepatitis A always recovers and have a lifelong immunity. So they recover very much quick compared to other types of hepatitis. So hepatitis A is mild, it's not really severe, but when it gets severe, it causes death. It causes liver failure, and which leads to death. But it has a very low mortality rate. So this type of hepatitis usually occurs as a result of poor hygiene. How you can contact this: a bad sewage system, dirty environment, and all that. This is a major cause of this type of hepatitis. So now I'm going to be mentioning some symptoms of this hepatitis A viral diseases. And again, I want you to understand that the symptoms, ranges from mild to severe. So some of the symptoms are loss of appetite, discomfort, abdominal discomfort, then nausea, diarrhea, dark colored urine, and jaundice. So again, these symptoms are seen, like they are very physical in adults compared to children. So children are most times asymptomatic, like you don't get to see the symptoms, you don't notice it. So this is why it is very dangerous for a kid to have contact, to contact this viral disease. So again, what causes attack to the liver is because of the drugs we consume in order to get better. So after the person must have gotten better, it brings a little damage or inflammation to the liver. So I'll be listing things. If you already have hepatitis virus, there are things you could have control over in order to help your liver not to get more weak or damaged. because the virus already has a damage on the liver. So you need to avoid some kind of things in order to stay a little healthier and help yourself to have a balance and not to damage the liver the more. The things is to avoid inhaling paint fumes, paint thinners, glues, and nail polish, household cleaning agents, um, anything that has potentially toxic chemicals that could cause more damage to the livers, because these things has chemicals that when you inhale them, it goes straight to the liver to cause more damages. So you need to avoid them totally. So you need to avoid um, drinks that has added sugar. You need to avoid it. Drinks like fruit juice that has added sugar, soda, and any drinks that has added sugars, or even packaged snacks that has added sugars. You need to avoid it in order to help your liver. Again, you need to avoid foods that contains fats. So all the fatty meats that are fried in vegetable oils, you need to avoid it too. Again, you need to avoid smoking or intake of alcohols. You need to avoid it because these things, they come to the liver for filter. You already have problems, injuries in the liver, so you don't want to bring more problems, because you don't want it to get to the stage you'll be needing a liver transplant. You know how hard it is to get a donor, and how much of expenses it is, and it will how much of expenses it will be to your family. So you are advised to stop the intake of alcohol and smoking, because these things causes naturally, they cause damages to the liver, and you already have an injury to the liver. So you need to avoid these things like a plague. You need to avoid anything that will make you to be found doing them for the sake of your health. So there are foods you can eat. So you can eat to stay healthy and also to help your liver. You can eat whole grains, you can eat fruits and vegetables, you can eat vegetables like cucumber, you can eat vegetables like cauliflower, you can also eat lean meats. So this kind of foods, you need to eat healthy, you need to be on a healthy diet in order to help yourself to fight this viral disease, to not bring more damages to your already injured liver. So I would like to state the preventive measures to attacking these infectious diseases, this hepatitis A. The only means to prevent it is through good sanitation, a proper personal hygiene, and through staying out of endemic areas, like places you can contact it. And also, the major means of being prevented from getting contact of hepatitis A is getting vaccinated. So there are little ways you can reduce the spread of hepatitis A is through proper sanitation, through supply of safe drinking water and safe food to communities, and proper hygiene, like teaching our young ones or people around you to always wash their hands with soap before they eat, or using a hand wash to wash their hands before they eat, before they will have to do anything. When you use the toilet, you wash your hand. When you use any public places, you wash your hand before you have to put something in your mouth. These are the only ways you can limit the spread of hepatitis A. The preventive measure is the short preventive measure is by taking a vaccine, hepatitis A vaccine, like taking the vaccine. That's you be 100% immune from having contact. um, you'll be 100% immune from contacting it.